Well, it's noon. We'll go ahead and call the meeting to order, and we'll start with the approval of the minutes from last meeting.
I'll make a motion to approve the meeting. Second?
Have a first and a second. All in favor?
Aye.
Opposed? Same sign. Motion carries. We'll go right to the mid-staff meeting summary by Dr. Brian Anderson.
All right, well, I haven't been able to attend the last couple meetings of this board, so good to be here again today and just give you a little overview of what the medical staff has been doing. So our last meeting was earlier this month on June 11th. Laura gave us the ACO measures and we received the quality improvement reports from the various departments, and I can say that really throughout the health system our quality continues to be very good. There are lots of good departments and people that are dedicated to doing things right, and I continue to feel like the overall quality of our health system is good. So I'll just kind of say that as a general comment. Laura talked to us a little bit about keeping our problem list current. So whenever patients come in and see us, they have a problem list. For the people that are sicker, they have longer problem lists. For those that are generally healthy, the problem lists are short. But it's important for us to keep our problem lists current so that things don't get missed. We depend on those problem lists to kind of guide us as far as making priorities in the visit. And sometimes it's easy to get lax with the problem list. You resolve problems, sometimes stay on the problem list too long, and sometimes new problems don't get put there. So it is easy sometimes to miss things if those problem lists aren't current. So Laura emphasized the importance of that to us. We talked about that a little bit. Just a comment about CT calcium scores. Some of you may have heard of that particular screening test. It's fairly new, and we're starting to do more of them. It's a way for us to risk stratify people a little bit better as far as coronary disease. It's a CT scan where we can detect how much calcification there is in the coronary arteries, and that's kind of an indirect measure of how much cholesterol buildup there is, and so you can kind of predict somebody's risk of heart attack a little bit better with that particular test. So we're doing more of those now. Our radiologists are starting to read those. It used to be the cardiologists, but they're pretty busy with other things, and so that was recently turned over to the radiologist for those reads. But it's a good screening test, and again, we're doing more of those. By way of recruiting for the medical staff, I'm not sure if Jill Magnus was going to share anything at this meeting today, but Dr. Francis, Melanie Francis, is the new family medicine physician who also does OB. She's going to be starting in September, so we're looking forward to that. We had a pretty good lead on a general surgeon who was pretty interested in the practice here, but that has since fallen through. Apparently his wife was not wanting to move at this time. So we're still recruiting for a general surgeon to join the medical staff. I think Dr. Custer is doing a good job here. He's our interim general surgeon, so we're happy to have him, but still looking for a full-time. So those are some of the highlights. I guess I should say one thing about DAX. DAX is a AI program that runs off of a iPhone. It's just an application, and it helps the medical providers with documentation. So basically we start the application when we go in the room with a patient, and it listens in, and then it constructs a note based on what it hears for that visit. So it's not perfect. It's not as smart as I was hoping it would be, so we still have to go back and do some editing and review, but it does help with documentation. It cuts down on some of our work time that way. So we're glad to have that application, and we're continuing to work with that, and it will probably improve over time as is my expectation. So those are the highlights. If anybody has any questions, I'm happy to take those.
All right. Thank you. If there's no further questions, thank you, Dr. Anderson. We'll move to the quality improvement report by Laura.
Our last system-wide quality improvement meeting was May 15th, and the various departments reporting at that meeting. Diabetic education evaluated referrals and kind of the A1C levels after receiving education. They overall saw over a 1% reduction in that A1C. You want that to be a lower number after receiving the education. Diagnostic imaging reported on imaging recall and breast cancer screening recall rates where patients are called back in to have that repeated, and that was all right in line with the state and national averages. Education hosted their skills and competency day. They had 8 stations. It's a mandatory education for staff to attend, clinical staff on the hospital side. And there was 2 different tests, and they reported confidence levels and competency levels increasing from pre and post assessments, which was great. Infection prevention reported no healthcare acquired infections, and OB had reported no obstetric or newborn complications. Pharmacy reported no adverse drug events. The Rural Health Clinic reported on the ACO measures as well, which are look very good and very solid on our screening protocols. And Senior Life Solutions reported on follow-ups from the program discharge. They continue to contact patients after discharge at 1 week, 1 month, 3 months, and 6 months, which is a really, really great follow-up and check-in with those patients, and have really good results. And that is all I have.
Okay, thanks, Laura. Anything else for Laura? If not, we'll move on to the approval of personnel committee report by Janine.
Personnel committee met earlier. We reviewed credentialing for 3 initial appointments, 4 reappointments, and 2 voluntary withdrawals. I would make a motion to the board to accept this.
First, and a second.
Second.
First and a second, all in favor?
Aye.
Opposed? Motion carries. Now we'll go to Barry for some discussion on the approval of the Shelby County Medical Board, Corporation Board of Director reappointments.
Shelby County Medical Corporation has a 5-member board, and 2 of those board members are hospital trustees. So we need to get approval for a 1-year term for Terry Tornaton and Janine Larson. So that term will go through June 30 of 2025. So just need approval to have those 2 board of trustees for the Shelby County Medical Court Board.
I'll move that. If I can use to.
First.
I'll second it.
First and second, all in favor?
Aye.
Opposed? Motion carries. And we will continue with Barry on the CEO report.
I got a couple slides there. Jeff? Yeah, so I'm going to talk about the contract that the hospital has with Shelby County Medical Corporation for physician services. And the work RVUs is the basis for how we compensate SCMC for physician services. And I show this slide every year just to kind of give you a little information on this, just to make sure you understand what RVUs are. It's part of the resource-based relative value system, which is a measurement system developed by Medicare to estimate the resources used to provide services in the medical practice setting. It's also been used quite a bit for physician production-based compensation. So this year, we're currently, the contract that we're currently in is ending June 30 of 2024. Our current rate is $108 per RVU. We're proposing to move that rate to 110, about a 1.8% increase for that next fiscal year, July 1 of '24 to June 30 of '25. We're estimating the total cost to be about $6.3 million. We're going to spend approximately $6 million this year, maybe $6,050,000 this current year. That's what we're on pace to spend for this current year. So just a little bit more information about this. Shelby County Medical Corporation employs all of our local physicians, so all of our family practice, OBGYN, our podiatrist, and our general surgeon. And then they also contract with a lot of the specialists that come out and provide services in our specialty clinic. So our gastroenterologist, our ENT, neurologist, orthopedists, ophthalmology, and then the newest one will be our pulmonologist, Dr. Veit and Dr. Toon, which will actually be starting tomorrow. So those costs are also included in this $6.3 million. There's also other administrative costs. So some of my time, HR, payroll, finance, quality, risk management, those are all also costs that are purchased back from the hospital. So those are included in that $6.3 million. Also, obviously, directors and officers liability insurance, work comp, other insurance costs are included. Some of the changes that are happening this year compared to last year, Dr. Natalie Francis will start in September, so that's an additional provider, and we're also budgeting for another provider to start January 1 of 2025. So that's included in, we're making that assumption that we'll have another provider at that time. And then the only other change really is our pulmonologist, Dr. Veit and Dr. Toon, that will be starting tomorrow. And I think those are the main reasons for the increase in cost. But I do need approval from the board to contract with Shelby County Medical Corporation for those physician services. Any questions about that?
Is there any indirect cost for buildings or office or?
No, it's really just
I didn't know, that's not customary probably.
No, they don't. Shelby County Medical Corporation, we own that service. The hospital owns the building and owns all of the services where they're providing. So the rural health clinic is owned by the hospital, and we do all the billing for them. So they're not billing for their own services. So there wouldn't really be any facility costs associated with that.
Well, okay. Speaking of their offices and stuff, yeah. Okay.
So I would move the approval of the increase in the RVU rate as part of the contract with Shelby County Medical Corporation.
And we're going to go to $110 per RVU. Would also be in the, don't want to change your motion, but
Thanks, Jim.
Second that.
I think that was a second, wasn't it?
All right, we have a first and a second. All in favor?
Aye.
Opposed? Motion carries. Now we'll go with Christie on the approval of the monthly financial statements.
Okay, so we have the May 31st, 2024 and 2023 financial statements up here, summary, and the year-to-date. So in May, we did have some decreases in service. We had 4,618 visits for outpatient services, 489 emergency room visits, 105 surgical procedures. The Rural Health Clinic had 3,391 visits. Behavioral Health had 1,458, which is up a little bit more than last year. Our average daily census was 6.86 patients. We did have 10 births in the month of May. So our operating revenue was $4.9 million, almost $5 million there in operating expenses. So So we had a little bit of loss of 51,000 from operations. Non-operating net is 206,000, so we had 154,000 in net income for the month of May of 2024, and in 2023, it was 169,000, so just a slight decrease there. Year to date, we did see quite a drop in our outpatient visits. We've been showing an increase in outpatient visits so far, but we're at a 0.5% loss from last year, the 11 months of 23 to the 11 months of fiscal year 24. We're still seeing a 1% decrease in our emergency room visits, 8.8% increase in our surgical procedures. Physician clinic visits were down 2.2%, and behavioral health is up 0.7%. And our average daily census is down 16.7%. Births are down 13.6%. Our revenue is up 9.2%. Operating expenses are up 4.7%. And our non-operating net is up 3%. So year to date, we're up 7.7. Wow. We almost are double, 107% higher this year. So we're at 4.3 million, almost 4.4 million net from all sources this year compared to 2.1 million last year. May is, so then this comparison here, you can see again the last 4 years we've just continued to increase, say with outpatient visits, emergency room visits, we're down there in 21, that was during COVID. So we've seen pretty consistent 5,200 visits to our ER for the first 11 months of each of these fiscal years. Surgical procedures, not big fluctuations in those either. The physician clinic visits, again, we've seen a little bit of an increase there in 2022 when we had COVID there. Then we've been consistent the last couple of years there, a little 38,000 to 39,000. Behavioral health is pretty consistent there. The last couple of years is about 14,830. As you can see, we've just continued to go down with our inpatient visits. Births, we've kind of ebbed and flowed there a little bit, hovering around 80. And you can see what our revenues there from operations have done pretty good this last year, and net has fluctuated just with COVID funding from the federal and state governments. So gives you a history there of when we had a lot of income there from those sources, and then the last couple of years, and then we've seen the increase in direct Medicaid program payments this year. Any questions on the financial? Just another thing to mention is we're hoping by the end of this week, or the end of which is the end of the fiscal year, to be caught up on our Change Healthcare postings. The delay in posting those payments because of the interactions with that software package that had an outage in there. So hopefully we'll be getting caught up. We're getting statements out to the patients now, and we'll have all that cleaned up. The staff has done a lot of work, and really it will be haunting us for a few months anyhow, just cleaning up from denials and having to be in 2 systems, but they'll make it work. They've done a great job getting that done. So hopefully we'll start seeing our AR days down again after all those are posted. I think we're down at least 35 days in just getting those posted. So good to get that project done and off our plate. Hopefully it won't happen again. So any questions on the financial report?
Okay, no questions, can I get approval of the financial statements?
I'll make the motion to approve the monthly financial statements.
I'll second the motion.
Got a first and a second, all in favor?
Aye.
Opposed? Motion carries. And we'll stay Okay, with Christie on approval of payroll and claims, if there was any questions or any comments that,
There was a question on there. There is a big $234,000 payment on here. It says to Hy-Vee accounts receivable. That has to do with our 340B program. Medicare charges them a direct fee, and then they can turn around in our contract and charge that to us, and there was quite a delay, so it's a pretty long time frame. And that will be changing, so that's what that was. It's a reimbursement for a fee that Medicare charges for 340B drugs with Hy-Vee. They're one of our contract pharmacies. So it's not that we went and spent a bunch of money at Hy-Vee.
Quite a party.
it wasn't a tailgate party.
Yeah.
I wasn't invited if it was.
So I just wanted to explain that one. Otherwise, they're pretty similar, run-of-the-mill, our normal operating expenditures.
Okay, if no other questions, can I get approval of the payroll and claims?
Moved.
First,
I'll second.
and a second, all in favor?
Aye.
Opposed? Motion carries. And now we'll talk about the approval of operating and capital budgets for fiscal year 2025, and Christie will also do that.
Okay, we met with the Finance Committee, which Mike and Jan and Kate are on last Thursday on the 20th. Went through a detailed description of our increases in our operations budget next year. So our operating, so you've got the summary here. The operating revenues are budgeted to go up 12.68%. That is largely because of increases in services. We're going to have pulmonology, we're going to have some rate increases. Our contractuals are going down a little bit because we have the Medicaid money coming in. So that's really the big increase there. Really no decreases. We have talked, I meet with all the department managers, we talk about their volume increases or decreases. Expect to see a slight increase in most departments, and one department will see a couple of departments will see a little bit of a decline in, just because it's been such a busy year this year. And they kind of see, history shows it's kind of ebbs and flows, so we're conservative there. Operating expenses would be going up 12.77%, so pretty similar. And that is a result of really just looking at the cost for the provider services that we have, addition of the pulmonologist, addition of looking for a second track to run in Senior Life Solutions, so that had an impact on revenues and expenditures. Increases in fees that we are charged for supplies, for services, really that, and then wage increases. So we do build in a wage increase for January 1 that will be decided as we look what our financials are at that point, and also what the IHA survey is. So we just kind of estimate what we think it should be. Built in for a couple new positions. We've had some long-term positions that we've gotten filled this last year, so that created an increase. A nurse position that we're adding. We've added the weekend clinic at the RHC. We'll add additional staff when Dr. Francis comes on board. So all of those are figured into the budget. And really nothing else to note there as to what the increases were. So we're budgeting $63.4 million in proposed budget for operating revenues, $61.8 million, up $61.9 million in operating expenses, so $1.6 million operating revenue, our operating net. Non-operating is $2.6 million, which is down a little bit as we use our funds that we have in reserves for the projects that we have going on. We'll see our interest decline. So we're looking at a projected revenue from this year, net income from this year of $4.1 million to next year at $4.05 million. So not a big change from what we're anticipating that we'll have this year. Any questions on the budget, the operating budget?
If no questions, we'll get an approval of that budget.
I'll make a motion to approve the budget as presented.
Second it.
Have a first and a second, all in favor?
Aye.
Opposed? Motion carries.
So for the capital budget, I didn't know, I should have brought a list, but anyhow, for the capital budget, we go through with all the managers, you know, a 3-year planning process for what they anticipate they'll have to replace in their departments as in terms of equipment or ads. We look a lot at, you know, what is our facilities. We do not include any of these major projects like the ER and stuff in this budget, but we did have an approval for this fiscal year of $2 million and we will be pushing that. We've actually put off one purchase to this next fiscal year since we were that close to the budget and we were this close to year end. It wasn't going to make that much difference. So next year, based on that list of what the managers really feel like they need, we are requesting a $2.5 million capital budget for next year. The list, we did get it down to about 2.7, but we evaluate those as they come available too, and we get proposals, and anything over 100 grand on there comes to the board for approval prior to those purchases anyhow. So we would like to ask for a recommendation. The recommendation is a $2.5 million budget for capital equipment and facilities.
All right.
I will move the approval of that $2.5 million for equipment and facilities in capital budget.
Second.
First and a second, all in favor?
Aye.
Opposed? Motion carries. And is there anything else that needs to be discussed?
Do you want to provide just a quick update on the ER?
Sure.
Where we're at?
Yeah, things are moving real quick with the ER. Sent some pictures out last week. Hopefully you received them all and see some changing. But for the most part, painting is probably 80% done inside. Sheetrock's probably 90 to 95% done. They've started to put up all of the millwork, so the cabinetry in all of the rooms are being placed. Doing final hookups on network and power and HVAC. The air unit actually is to be turned up this week. I walked through last night, it was 87 degrees in the workspace, so I'm sure they will really appreciate air conditioning in there. So a lot of teams are working in there to move the ED forward. We're still on track for a mid-August acceptance date, so things are moving well there. The cafe has had a lot of changes over the last short while also. The end of the month, actually the 30th, is that next, coming up here pretty quick. All of our furniture arrives, the booths and tables for the cafe. They placed the grill this week, yesterday, doing a lot of lighting. We have closed off of the hallway that goes into the kitchen so we can finish that. So the last couple pieces will be the hallway work that's there. A couple more pieces of glass need to come in and be installed, and then do a final clean and move forward with that and open and start serving. That's expected to be in the next 2 weeks or so, give or take a few days. So things are really moving there. So it'll be nice to get in and see all of that done. A few delays, but I think the end product's going to be really nice.
That went fast.
Yep, that will be nice to get that project completed. So I think the cafeteria is really going to be nice when that's done as well. With coffee shop right down there. And it'll be a nice amenity.
They seem to have done an amazing job with the temporary serving.
Mm-hmm.
Yeah.
Yep. yeah, that's worked out just fine.
Okay. I think we're good. Can I get a motion to adjourn?
Move.
One second. First and a second, all in favor?
Aye.
Opposed? Carries. Thank you.
Thanks, everybody.